As you mentioned, my name is Will Young. I do work at Intermountain Healthcare, but I have to tell you, this conversation really hit home for me in this past week because I don't know if you've seen the article, but my CEO was just recently in the news talking about this same thing. And he says that we are going to be the next Tesla, but of healthcare. And he gets a lot of people asking him, are we going to be the battery? Are we going to be the one that's subbed out? Is our department the one that's going to the cloud? And that really hit home for me, especially in IT services, and we're talking about DevOps, right? Finding a developer almost seems easy these days. Are we going to be that team? So that's what my focus is going to be today, in talking about some real-world examples of how our team provides value, not just internal to the other IT teams and talking about the infrastructure and operations teams, but also expanding that value out to our other business and clinical units, so that we can prove our value to the business and hopefully not become that battery, or at least become the best battery and be the outsourced provider that our CEO is going to select. With that, I'd like to tell you a little bit about myself. I was born in an inescapably medical family. I was born at an Intermountain hospital. In fact, this is me in the pictures here being born. That's my mother, who's a nurse of 30 years, and my uncle, who is a physician. My sister's in medical school. My grandpa was a physician. My great-grandpa was a physician. And I have medical family all throughout, aunts, uncles, everybody. So you can imagine how excited they were when I said I was going into IT. I've done a few things in my life. I love to volunteer. I've always volunteered at the hospital. It was like a second home for me. I started as a desktop support intern 5 years ago at Intermountain, and I've worked my way on up from there. I also worked at our supply chain as our asset lead, so we have a centralized supply chain that we do all of our hardware ordering and inventory systems, and I help them design and set up that process. Also worked as a project manager, and now I'm in service management. I've done incident, major incident. Currently I'm over asset, CMDB, and then a whole bunch of sub-processes that aren't big enough to put on the chart. I've worked in the U.S. Army. I was in the Civil Affairs, served there for a while, as well as the National Park Service. I do have my ITIL certifications. I'm a system admin for ServiceNow. We've been live there for about 18 months. And then I am the group leader for ServiceNow Utah Group. Intermountain Healthcare is the largest healthcare provider in the West. We're based in Salt Lake City. We are a not-for-profit healthcare delivery system, which includes our medical group and an insurance company called Select Health. We serve the healthcare needs of all of Utah and then a little bit of southeastern Idaho, but we also have an expanding telepresence in regional hospitals in surrounding states. We're composed of 22 hospitals, 185 clinics. We have 1,400 multi-specialty physicians that work directly for the company, and then about 40,000 employees that we're getting to now. In general, IS employs about 1,500 employees and managers. We're organized into about 450 fulfiller groups. There are about 100,000 items in our CMDB, and we are just launching into our CMDB discovery and mapping project. So we're expecting that number to grow exponentially over the next year. Right now, we create about 3,500 requested items every month, 45,000 incidents per month, and roughly 150,000 notifications per month. And when I say notifications, I don't just mean incident notifications. I mean notifications that go through the xMatters platform, some of which you'll see in later slides. I'm part of the service management staff, and we have 16 team members divided across process and DevOps and management. We support the ITIL processes across the whole company. We previously used solutions from BMC, CA, other large ITSM providers. We've been live in ServiceNow for about 18 months, and we've been xMatters customers for about 5 years. One of the most rewarding things about working in a healthcare company is seeing how technology can enable caregivers. For example, we help support LifeFlight, this is our LifeFlight helicopter here. It's an Intermountain-owned rescue and medical transport service with an accompanying fleet of helicopters and fixed-wing aircraft. Back in 2001, the FAA approved us to do external load hoist operations, which is a fancy way of saying that we can do emergency rescues. Those are normally just reserved for fire, EMS, sheriff departments. We're the only organization that I know of that has a license to perform that as a private company, not related to emergency services. IT supports LifeFlight and other clinical operations, obviously, in various ways, from monitoring and alerting for organ transplants to size and weight conscious digital document delivery in the cockpit, Obviously, all of our flight operators can't have a 100-page manual sitting in the cockpit with them, but they can have an iPad. And we have to design those solutions to be very situation appropriate for being in a cockpit of an aircraft. At the end of the day, I know that the work that I do makes a difference in patients' lives because Intermountain has a very data-driven culture. Being a healthcare company, data is very important to us. And I can see how the clinical initiatives align with the IT initiatives and how they really come together to make a difference in patient outcomes. When somebody rolls into our hospitals or they're transported on one of our LifeFlight helicopters, our physicians rely on the quality of our IT services to save lives, and that really is a big responsibility. So let's talk about the problem that we were trying to solve. Back in 2015, one of our clinical units asked IS about improving their communication capabilities to quickly engage physicians. The tools and processes that were in place were manually managed, they were not automated at all. It led to a lot of hours being wasted in trying to engage the appropriate people. Because IT had many years of experience of reaching out to the correct technicians and getting the correct on-call people and using scheduling, they looked to us to help them figure out a way to solve their process problems. Just like IT had done for years before, clinical teams were notifying everyone at once, what I like to call the spray and pray. We're going to send a message out to everybody, and we're going to hope that somebody who gets that message can do something about it. That led to a lot of frustration. So in other words, clinical teams wanted to stop shouting and start collaborating. And that's something that we continue to work on in IT. We're not perfect at it, but across the board, we are seeing that these clinical teams, technical teams, business teams, doesn't really matter. They were getting too many notifications, the wrong time of day, the wrong people. The responses that were coming back were not measured. We didn't know the effectiveness of the messages that were going out. How can you manage your business when all you hear is noise? You're not even sure what's actually happening anymore. And when patient lives are on the line, a quick turnaround time is really essential and can be life-altering to our patients. One of the ways that we teamed with the clinical business units was through integration with our telehealth services, especially around Telestroke. When a person has a stroke, they lose about 30,000 neurons per second. As Dr. Hesch likes to say, time is brain. In this highly critical environment, pairing IT tools with clinical processes helped to reduce the response time by 80%. We went from 15 minutes to get a physician on the phone and diagnosing the patient to 3 minutes. And that's not a joke. I can go look in the xMatters system now and I can see the average is about 2.5 to 3 minutes by the time that we get a physician engaged. To give you a comparison, the national average is 30 minutes. So we're only 10% of the national average in our response time, 90% reduction. Every minute saved is really a patient life improved. We're not just talking about IT systems. We're not just talking about getting the major incident resolved. We're talking about a patient who's losing brain cells at a rapid rate. When we took the lessons that we learned from that Telestroke case, we applied them to other telehealth patient areas, including Telestroke is the first one, crisis care, pediatric trauma, infectious diseases, lactation support, and wound care. No longer do we have to have a specialty physician at each location and having to contact the people and get them into the room. Now our clinicians can press a button, it immediately contacts the specialist, and within a few minutes they're dialed into that room working with that patient. A combination of automated integrations and then some manual user interfaces has helped us support better outcomes across the healthcare system. As you can imagine, data and access to that data in our highly regulated industry is really, really important. Whenever possible, we like to use visuals like this timeline that's the out-of-the-box timeline from xMatters so that we can quickly spot issues and discover who messages were sent to, which devices, what time, what their response was, all in one big glance. When our clinical teams then report their times for national averages, we're very confident that the data they have is going to be 100% accurate. Prior to IT's engagement, I'm sure that some of our business leaders felt like this guy, banging his head on the wall because the information he was getting was always too little, too late. Often our business leaders were piggybacking onto our IS alerting, which were messages were too technical or they were just not timed to the correct business situation. One of the best things that we did for them was to separate our communications into two different streams. So now we have an IT communication stream that talks about the technical side of things, and then we have a business communication stream that talks about how to respond to those events and what to do about a system being down or about a particular event. As the clinical teams began to see returns on their investment in this particular area, especially around technology, additional use cases began to appear. For the first one, we had our medical record team, which is Icentra. We're in a partnership with Cerner, and we're deploying our medical record system. And they came to us and asked us to help them with their communication difficulties. We're able to offer them a quick turnaround time because we already had the xMatters platform in use for IT, so we simply created some new communication plans that revolved around business communications to their users. This helped them reduce their leadership frustration, no more banging heads on the walls. It also paved the way for other teams to adopt messaging, business messaging services that we'd never had before. And that includes our imaging systems, so X-ray, ultrasound, anything that is a medical imaging, they can now notify their downstream users. Same thing with pharmacy, we're developing for them. We have retail pharmacy, hospital pharmacy, and a supply chain pharmacy. So if there's an issue at the supply chain, they can notify all the hospital or downstream pharmacies of what that issue may be. It doesn't have to be IS related. They can go ahead and send whatever types of messages make sense to them. And then Select Health, or our health insurance branch, is focusing on their facility alerts. Any sort of issue that would cause them to leave the building or to not have to come in for the day because there's an issue, they're developing communications around that. As more teams become aware of what we're offering in service management as it relates to communication and engaging teams, more and more use cases, I'm sure, will come out of this. To support a positive user experience, right? Some things that we do in IT are not very user-friendly. We like to give tools to our users and say, well, it works. You didn't tell us it had to be pretty. So we focused really heavily on using things like dashboards to make it easy for our users to quickly send messages or to see their messages or to really perform any aspect of the communication. In this example, you can see we enabled our Icentra team to send both business alerts and technical alerts. Plus, they have visibility into both of those sections so that they can quickly copy and paste if they need to, or they can see what was the last technical message that came out before I go ahead and send a business message. And then, of course, they have their own formats for their messages that go out on mobile phones and text messages as well. Another example, this is just our business alerting, and this is for our imaging systems. They can see alerts from two different queues. They can see the Icentra alerts, which is our medical records. They can see RAS alerts. Because those are often triggers for their communication processes to start. And then from there, they can go ahead and create new messages or copy previous messages and make changes. You'll notice that there are different formats behind each of these. There's different users behind each of these communications. There's different preferences and setups. And the users don't have to know anything about that. And that's the best part, is we just give them a simple form to fill out. We give them a simple process, a simple dashboard that has a whole lot of power behind it. But there's very few questions and very few issues that ever arise out of it. And finally, this is my admin view of all of the messaging queues. Across the top, I have messages that users are sending manually in the web or mobile interface. And then the rest of my queues are automated, so some of them come from monitoring, some of them come from our ServiceNow integrations, some of them come from our data warehouse. It just depends on who's using it, and this dashboard continues to grow and grow and grow as I get more and more teams that want to participate. It's really nice to be able to come in here and just at a glance see, man, there's nothing coming in for this incident alert right here. I wonder what's broken. And then remember, oh, we haven't deployed that yet. As we develop the communication plans for our internal customers, and again, this is a difficult conversation sometimes to have because I am split 50% between process and DevOps. So a lot of the things I design, of course, I can't design anything that I'm responsible for. But focusing here as a process owner, we like to develop our communication plans for our internal customers, but we want to make sure that we never let the technology drive the process. And that's really hard to do when you're really embedded in the technical side of things because you love your tools and you love the way that things work and you love the way that IT does things. But we still look to our DevOps lead to give us some of those best practices. We're not going to ignore the technology when we design a solution. We have to be aware of that technology. We have to work with the technology. Our IT organization, probably like yours, has a wealth of experience in communicating and reaching out to technicians, in escalations, in on-calls. And so we bring in their consultation as soon as we can in the process not just from the technical standpoint, but from the experience standpoint, to help us understand some of the best practices they've seen in their own environments in terms of getting a hold of people. It also gives us the ability to build some forward-facing solutions. So instead of designing a solution that works now and we're going to have to rebuild it next year, we can do some planning ahead and see the changes that are going to be coming and see the platform changes and just really plan for those things instead of being surprised for them down the road. This ensures stability, supportability, all of those great things that we're looking for when our environment grows, being ever more complex as it is. We use the ideas from our ITSM world, so this is part of our major incident alerting here, and we use that for our business partners as well to manage their communications. One of the ways we do that is by utilizing response options and then using integrations to either perform actions or to record those responses. So in this case, we like to record the engagement that we get from our teams as they respond to messages so that we can record not only the average time, but who is engaged on this issue, who is aware of this issue. We know they're aware because they responded. We do other things like perform automation. We allow users to set quiet times for their messages. So all we have to do is send a page out to them, and if they respond, it'll automatically update their device preferences for them so they're not getting notifications during all hours of the day. The more things like this that we can automate and not have to have users log into this system at all, the greater the return on investment that our business partners see, and the more likely they are to come back to IT for more solutions. This all helps us move beyond the traditional notion of paging and closer to our goal of turning notifications into real conversations. Traditionally, paging has been thought of as a one-way communication meant to warn or to inform. And we've transformed alerts from just being a notice to a conversation where recipients begin to communicate and collaborate together. We help our customers understand their information supply chain. It's not just sending a message out. There's a stream of information. Where does it come from? Where does it go? What do we do with it? And we want our customers to understand that when they start setting up communication. We help our customers understand that it has to go from the top to the bottom of the organization sometimes. The message that you start with at the very beginning is not the message that needs to be relayed to the users, and we have to separate those things out and define them from the beginning. Some of the ways we do this is to use multiple communication streams, as I mentioned, provide clear response options. If I'm going to send somebody a message, there better be something that they can do about it, or at least some way for them to let us know that this isn't the appropriate message for them, and we should fix that in the future. Record and measure engagement. Again, avoiding that spray and pray, find some way to feel like your users are engaged, that they're participating in the conversation, and you'll get more engagement that way. We also like to sign our messages with the sender's name so they're personal. So instead of them just saying, this is a message from Slack, this is a message from ServiceNow, it actually is signed by the person who's sending that message, and they know who to contact if they have any questions about the event that's happening. And then last, encouraging feedback. It's easy to set up a communication and just let people send messages all day long, but if they never get feedback about how it's working, how will we know our return on investment? How will we know that we've accomplished our goals when it comes to the user experience? All of this helps us meet an ongoing challenge that we have at Intermountain and really in the healthcare industry, and you probably feel the same in your industries, and that is to do more with less, which is such a counterintuitive idea. Do more with less. We're going to give you fewer resources. We're going to give you fewer employees. We're going to give you fewer things. And we are increasingly asking more and more of IT. We want you to deliver these Amazon-like experiences. We want you to deliver the Google-like experiences, but we're not going to give you any more staff for it. Industry changes, especially in healthcare, are impacting the way that we do business every day. And this was once an official motto, but it seems to be the official motto these days of Healthcare IS. This is what we have to do. There is no choice. There is no option. We have to find ways to innovate, to automate, to improve. The more lean and responsive our IT organization can be, the better outcomes that we provide for patients. Not just our IT teams, but ultimately this does affect patient care. And then the more secure our jobs become. If we can do more with less, and we can automate, and we can innovate, and we can show that return on investment, we can show, at least in my case, the CEO, that we don't need to be outsourced. We can do a better job in-house. So here's an example of how we're doing this on my team, and that's by cross-training, granting access to other teams so that they can manage aspects of their shared services. So the business challenged us by asking that we support all the ITSM processes with a very limited staff. 40,000 users, we have 7 process stewards, 3 of which are shared at least half-time with other organizations. So our incident manager is only half-time incident manager, also half-time on security, and also responsible for about 3 other processes. Almost impossible when I talk to other organizations. They can't believe that we do this. And that's because we've turned some of those shared services into shared responsibility. Some of the things that we've seen out of this is a reduction in translation errors. When a technician calls to report a major incident and somebody's taking that phone call, they have to understand what's going on. And if they don't quite understand, they might misrepresent what's happening. In one example, we had a service desk technician who sent out a major incident alert who didn't understand the difference between VMware and VDI, VDI being the virtual desktops and VMware being our virtual hosting. And so sent out a message that said all of VMware was down, which of course caused a huge stir. Everybody thought all their servers were down. Simple things like that, simple technology terms that somebody new simply couldn't understand. And so by turning that message over to the team who's responsible or who was reporting it in the first place, they know what terminology to use. We provided them simple enough tools that they're sending out the correct message to the right people without having to go through a list and select, oh, is it Bob's team? Is it the network team? They just fill in the form, they click send, the system finds everything for them. We've also seen a reduction in the time from detection to alerting the enterprise. So instead of having those extra steps of having to contact people and what happens if the phone doesn't ring and what happens when the 800 number system goes down, which it did last year, we see all those things just adding time to being able to detect and then get somebody on the phone and get it solved. We've also seen a reduction in the time to request or change access, which the business loves. They hate waiting to get people onto new services or to give them permissions or to provision them for whatever it is. We've automated that. They're responsible for their own. Somebody requests to be added to your particular communication or to be added to alerting, the business owner approves it, and the system automatically adds them. There's no more IT involvement. And then lastly, teams feel more empowered when they can talk to somebody on their own team instead of having to call another team. They feel like it's that punitive, oh my gosh, I broke it. Now I'm going to have to call service management and talk to the incident manager and explain to them why I broke it. And they avoid reporting things that maybe they should have reported earlier. But now all they have to do is turn to a team lead or a manager, and the manager can make those determinations and send those messages out without having to call anybody else. So we're pretty excited about this change of responsibility and distributing it out to our teams. There's going to be more struggles as we go along. We're expecting more teams here in the near future, but pretty excited about this change of responsibility. So looking forward, my team is looking forward to a lot more free time, or at least a lot less time managing our platforms and our systems for our customers. With the big changes happening in healthcare every day, we plan to be ready for them by doing more with less. We're adopting flexible platforms like xMatters and ServiceNow. We use industry standards like ITIL, Technology Business Management, or TBM if you're part of that, Agile, Scrum. And then those things really help our organization, our IT organization, and our broader organization to be more lean and efficient, leaving more time for important things like continuous improvement, which is a huge focus for us. We have an initiative called Zero Harm that applies to all of us. We consider ourselves all caregivers, no matter what part of the organization we're in. So if we can find a way to reduce risk, we are reducing potential harm to patients. Part of my goal for the future is to help unify teams across the organization, break down the silos that we're all facing. We want to expand IT usage of xMatters platform to include other processes like change, SLA, and event management, which we aren't doing now. We want to see xMatters no longer be treated as an IT tool. Even though we have these clinical use cases, it's still been a primarily IT tool, and IT owns the tool, and IT sets up people in this tool, and we want to move away from that and let business manage their own services. Yes, it's a shared service. We will never get away from IT involvement, but we want the business to feel empowered to do a lot of these things themselves. We also want to see a single database of contact information, whether it's emergency, routine, IT notifications, one place instead of one system in HR and one system in IT, and then, oh, you got to go put it in ServiceNow, and by the way, is your xMatters profile up to date? We want to see one place for all of that kind of contact management, and it's getting the teams to participate in that that's going to be the challenge. And then the last is to integrate more systems and more systems and more systems. So that may be SharePoint, which we use very heavily. It's our internal .NET site, and it has a lot of our information and our policies and procedures and all of that technical stuff in there. We also have HipChat, Jira, other tools that we want to see automated more. We are integrated with a lot of things like monitoring, allowing teams to get their monitoring alerts directly instead of creating an incident first, and just continuing to expand all these branches that we have out into these different organizations. I've also begun working in multiple customer-driven user groups, and I have to say that customer-driven is really important. A lot of vendors try to give you a user group, and then they run it for you, and it never turns out the same. So I want to give props and kudos to xMatters. They know how to run a customer-driven user group. They set up the WebEx, and they walk away, and they let you discuss whatever it is that you need to discuss. And we have one for xMatters that includes some healthcare companies, Dignity, Banner, Cambia, Intermountain, Providence, and other teams, Texas. They're all joining to have discussions, not just around xMatters as a platform or xMatters as a tool or xMatters as a service, but to talk about industry standards around communication. And we get to define those industry standards. I think that's what's cool. Having the large healthcare organizations, we can say, you know what, our standard across organizations is going to be this. We're going to take a best practice from one company and we're going to apply it to another company, or we're all going to have the set standard, or we're going to all write a paper together. So if you have any interest in any sort of communication or healthcare user groups, I have some in ServiceNow as well, another platform that we use. Let me know after the presentation. But joining user groups and participating in those discussions with leaders in the industry has been really, really helpful to us. Crossing the communication divide is a daily challenge, but we're growing with our business units, and we're providing cost-effective solutions to common communication challenges. If you'd like more information about Intermountain or how we're making these transitions, or anything else about what I've talked about today, feel free to email me, will.young@inl.org. And thank you for your time today.
Thanks so much, Will. So we've got time for maybe 2 or 3 questions. Anyone in the audience have questions for Will? Great. Let's start here.
How are you guys handling your communication between xMatters and these third-party like image management tools? So are you guys using an API integration?
So it's a combination. Some of them are business alerts, which are manually triggered by a user going into the web interface or into the mobile interface and sending a message. And then some of them are triggered by an API integration. And then if you want to get really complicated, sometimes they come in directly as, here's the message to send. Other times they come into the integration builder, and then that team manages a list of rules and things that they want to have happen to that message before it ever triggers a notification. So combination. Does that answer?
It's not a one-size-fits-all thing.
Not a one-size-fits-all. Right. And you saw all the queues, right? I have about 12 queues, and each of those has at least one kind of quirk to it. They're not all the same. So some of them can be reused with reusable code and shared libraries, and some of them are totally unique. Some of them we turn over to the team and let the team do all the management of it so that we don't have to go in and define their code and define what to do with when we get their messages. We let them do that.
Do some of the vendors provide API tools for you to leverage?
Sure, yeah. The big one that we use is ServiceNow, and we use the out-of-the-box integration for that one, and we do some changes to it. There's a huge list of out-of-the-box integrations that xMatters has that you can use. We haven't used a whole lot of those except for the ServiceNow ones, but that's because Intermountain likes to customize everything.
I was thinking more to the imaging document side, these other...
Oh, yeah, typically they don't on their side have something for xMatters, but they do have the API calls, which is about as easy. Yep. Mm-hmm.
Hi, thanks. It seems like you have a very mature model. Is there any use case you might elaborate on that you put in place that you would consider like non-standard setup for xMatters that added value to your business? Maybe like that use case we were talking about earlier. And then how do you see the integration with HipChat working? Is it more xMatters to HipChat or ServiceNow to HipChat?
Great question. So the first question is really hard. You said a non-standard integration, right, or non-standard. And the truth about xMatters is that none of them are standard, right? xMatters is so powerful that you could almost do anything, right? So they're all non-standard for me, and they all have some sort of custom code that we've went in and built. And I think it's the developer portion of it where we can assign and say, this developer has access to this particular section, but nobody else's. That's what makes it powerful for us, because I'm not in there coding all day long. Although as the administrator over the whole platform, I do have purview over every single one of those. So they're all pretty non-standard. I think the biggest deviation that we've seen is that Telestroke use case, right? Where people were thinking of xMatters as an IT tool and we're integrating it to things. Well, now we're talking about direct patient care. We're talking about a custom app that Intermountain built that's at every patient bedside, and when they press the button, it triggers xMatters to get the physician. That was pretty out of the box for xMatters at the time, and I think that now that we're seeing more of those use cases that aren't just around IT, we'll see less and less standard things happening because, like I said, xMatters can really do them all. You'll have to remind me the second part of your question. The HipChat integration. So HipChat is typically used when we have an incident. And so what I see happening is that either we build like a UI action inside of a ServiceNow incident that triggers xMatters to do the integration to HipChat, or we actually just allow people to go directly into xMatters and trigger a HipChat to basically start a channel, to start a feed with the appropriate people. Not sure 100% how we want to do it. The business problem we're trying to solve with that is that HipChat is not officially part of the incident process. So all the data and all the communication that's happening in HipChat is not being recorded and associated with the incident. So if we could find some way to tie those things together, that's really the goal. Yeah, I'll let you know.
I just second that last part. That resonates. Like, how do you move that back in?
Yeah.
Get it.
And we somewhat do that with xMatters, where we're using that two-way communication, right? And if you have the mobile app, you can do a free text response, and that shows in the incident ticket. And we're doing that with major incidents, right? So that you can leave your comments, hey, my team is on this one, Joe is our primary lead, send, now it's in the ticket and it's recorded. But HipChat has a lot more adoption for messaging because of the multiple people in a channel sort of a thing. So we're still figuring out how do we get them into the official systems. Other questions?
Any interactions with regulators, pro or con, on moving in some of these directions? Any concern about new technologies, new approaches?
That's a great question. So especially in healthcare, one of the big concerns is around PHI, protected health information. And right now we are set up that no protected health information goes into the xMatters cloud. We're working with the xMatters team and the platform security and trying to understand what these requirements are. We actually have a use case to start doing that now. There's not really a major concern. Our security team has done the review and is happy with the standard that we have. However, the note is it's not intended to hold protected health information. And that's the challenge that we have a lot of with our teams, is that they want to do a lot of reporting, they want to do statistical things out of xMatters, and our answer to them is you should be using your own systems for that, the systems of record that maintain all of those records in permanent status, and xMatters is just the notification delivery. So we're only going to hold on to those things for a very short period of time. But we are looking to increase our use like PHI, and because they have the secure delivery with the mobile app, we're really hoping to be able to enable physician communication about patients in xMatters in the near future.
All right, thanks for the great questions. We're